You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, minimally invasive or non-invasive facial rejuvenation. According to my first guest, it's possible to look years younger without surgery. With us, we have Dr. Halusic. Dr. Halusic, welcome to the program.
Thank you very much, Randy, for having me.
Good. Now, before we get into today's topic, your center, the Facial Surgery Center.
Yes.
Is that correct?
That is correct.
Tell me a little bit about who your typical patient is and what are the different procedures you do.
Sure. The Facial Surgery Center, we have two locations, one in Greensburg and one in Mount Pleasant. It's about 35 miles southeast of Pittsburgh, Pennsylvania. Okay. And we have two nice brand new facilities, very proud of those, state-of-the-art, both in technique and in decor. So we give our patients a very nice environment to come into. As far as our patients, Randy, we have a variety of patients that we see at the Facial Surgery Center. For example, we can have a 17-year-old that comes in for wisdom teeth. As an oral maxillofacial surgeon, we treat the young men and women, take out their wisdom teeth, IV sedation, make them very comfortable. And then, we can move on to the 30-year-old that comes in with crow's feet, the little lines around the eye and little volume deletion here that they need some filler. And so that 30-year-old can get some Botox and get some fillers. And then we can move on to the 45-year-old that perhaps needs an eye lift. And she comes in, she looks tired. She just doesn't look refreshed. Her friends are telling her, I'm just not you just don't look as good as you used to.
Okay.
So she'll get an eye lift and maybe some Botox and maybe some fillers, laser resurfacing, which is, something hopefully we can talk about later.
Sure.
And what's really neat about our practice is that this just happened to me. In fact, this patient, this 45-year-old, just came in, had her eyes done. I did her son's wisdom teeth, which is really neat. That's how she got introduced to our practice. And then her husband came in with her for a post-op and realized we did dental implants. So here's a guy that had broken down teeth. He went to the dentist year after year after year, root canals, crown and bridge, and just couldn't hold on to his teeth anymore, and needed a life lift with a new smile. And we were able to put some dental implants in. 4 dental implants give him a new smile in a day in conjunction with his restorative dentist. So it's kind of a nice variety of patients. And there we have a family. We have actually 3 patients, the wisdom tooth patient, the eye lift patient, and the dental implant patient.
Interesting. So as a maxillofacial surgeon, though, you guys get a lot of, reconstructive surgery on the face.
Absolutely. That's our bread and butter, and that's where we started. If you look at the history of oral maxillofacial surgeons, and you take trauma, for example, back in the Vietnam War, we were the #1 trauma surgeons.
Oh, is that right?
Oh, absolutely. And when I trained at Allegheny General Hospital in Pittsburgh, Pennsylvania, which had the first life flight service in the region, first helicopter, a lot of trauma. And when you treat trauma, Randy, you're treating deep, you're treating the bones, you're treating the soft tissues, we're treating the scalp, we're treating the entire face. And so it's excellent. That's the best training to then become a maxillofacial surgeon, because now you understand the anatomy, you understand how things go together and what it takes to give a patient facial balance and those kind of things.
Now, you've always been, we've talked on the phone, interested in the cosmetic aspect of
Absolutely.
This. And, surprising. And I said, I thought I knew your life story. We talked on the telephone. but you've been in around, you've been using lasers for skin resurfacing since the beginning.
Yes. Yes.
Is that right? How many years is that?
Oh, I think it was early 90s, actually.
Okay.
When the CO2 laser came out, I just thought it was phenomenal, because what it can do is take this wrinkly, prune, dry skin and just transform that patient into smooth skin.
Okay, interesting. Okay, so let's begin with kind of what's hot right now. The different procedures that you do for minimally invasive, things to look younger.
One of the hottest things, Randy, is all therapy.
Okay.
It tightens and lifts skin non-surgically.
What is it?
That's intense focused ultrasound.
Is that right? Where do you use it?
Well, I'm using it on the face, and that's where it's indicated right now. We can do brow lift with all therapy. We can get rid of jowling. If you want to call one thing the fountain of youth, Randy, it would be all therapy. It's that exciting. Absolutely.
Okay.
Absolutely. We're rejuvenating patients' faces, giving them that lift without surgery. And it's phenomenal. And if we can get to these women younger, they're never going to age.
What's the most popular procedure, by the way?
I would say Botox and fillers, definitely.
You do a lot of Botox?
Absolutely, a lot of Botox and a lot of fillers. Yeah, Botox for the crow's feet around the eyes. That's the main indication for forehead wrinkles. You know, patients come in, they look tired, that kind of thing. And then fillers to volume depletion. When we age, Randy, the collagen starts to break down around age 30. It starts to go the other way. We get hollows, you know, we get loss of volume. And the way you can replace that volume is with fillers. And it's a very easy procedure, you know, half hour, and they see results immediately. Let me give you an example, Randy. Here's a lady that had Botox, and when you look at her, you can see that, you know, she has these 11s. I mean, she can really make a frown there. Now, if she's waiting on you at the counter, you're thinking she's not too nice of a person, she's not too pleasant. That was her complaint. You know, she was complaining that customers were telling her, you don't look happy today, you don't look happy today.
Okay, all right.
So we did the Botox, in 4 or 5 days, they're gone.
You get Botox, by the way, because I'm noticing right now as you're
do.
saying that. You don't, so you couldn't look mad, I guess, if you tried, right?
No, I have an optimistic personality too, but yeah, that doesn't go.
You know, it's also very nice to see, you know, your wife. I met your wife at the studio. Flawless skin.
Yes.
I mean, literally a standout skin.
Yes. She has done amazing with her skincare. We have the Obagi skincare system in the office. Have had it for many years. It's a home-based system with medical supervision. And I'm telling you that and she's one of my best referral, you know, patients. I mean, the women that know her skin is flawless, and that's why. Now, what does Obagi do? It youthens the skin by a couple of things. Number one, it increases blood supply. It increases cell turnover. As we age, we have 5 layers of the skin, and those start to slow down. That's why patients get basal cell carcinomas and things as they get older. With Obagi, that turnover rate increases. More youth, better blood supply, and the top layer, the stratum corneum, which is very thick, it's the scaly layer, that gets thinned down. So when you treat the skin and you make it healthier, which is what you're doing, you're making it more beautiful. And that's why my wife has such beautiful skin.
Okay, good. I know you brought a lot of photos. And so let's begin with some of the things you're doing with facial reconstruction.
Okay, great.
And then we'll move on to, because I know you have things with the lasers and things like that.
Well, this is a young lady that we did facial reconstruction on. She has a severe asymmetry, a severe imbalance. This young person had a very low level of confidence. She, you know, was getting made fun of at school, and she felt very self-conscious about her situation. You know, she had a very bad underbite, very small maxilla, small upper jaw, large lower jaw, and you can see there's just, it doesn't look pretty. But what we're able to do by going ahead and doing the facial reconstructive work.
What do you do?
Like, for example? It's called orthognathic surgery, which means straight jaw. You know, straight jaw surgery. Basically, in her case, we move the upper jaw forward and up and the lower jaw back in conjunction with the orthodontist to level and align the teeth. And as you can see from the pictures, her nasal tip, we didn't touch her nose. We didn't do a rhinoplasty, but it sure does look cute, doesn't it?
In the after. Yeah, very nice.
Beautiful. And this was a changed person. I gave a talk to Business Networking Group last week, presented her case, and you know, it's very emotional because these kids get help so much.
So you have other photos. What are we looking at?
We do. Well, this is a case that I really like. This is a young lady that came in and did not like the way she smiled. She didn't like her nose. She didn't like her skin tone. And she just told me that I feel so tired for being in my early 30s. You know, my friends are telling me what's wrong with me, and she needed a life lift. I mean, she needed...
Interesting.
Yeah.
So what was she bothered by?
Well, if you look at her skin tone, and Randy, she really didn't like her smile. I mean, when you look at her smile, she was missing teeth. She didn't like that. You know, when she smiled broadly, the color, the fillings that were showing, I mean, just, you know, she wanted a pretty smile. So we were able to do that. In this case, me being kind of the foundation builder, I was able to put in 12 dental implants to fill in all these back spaces, and then her dentist did a beautiful reconstructive job to give her a $1 million smile. I mean, you know, that's what it's all about. Very happy now. Very happy, beautiful. And then we did a rhinoplasty for her, which was a nice change, and a chemical peel to get that skin evened out. And then she continued with my esthetician, taking care of her skin. Look at this after, Randy.
Wow.
I mean, we had a little help from the cosmetologist here. Her hair looks great too, but I mean, look at that smile. Look at the skin. I mean, this is a supreme makeover. And the thing I like about these patients is we see the physical, but when you get to know them, you understand the mental, that these patients have a new psychic, they have a new lease on life. It's exciting to see
Do
that.
they, I always ask the doctors on my show that, obviously you take care of these things that bother them for so long. Do you see change? What changes do you see? Are there personality changes? Do they dress differently?
Confidence, dress change. I've talked to some of her people at work that she works with. Different person. She works actually in a medical office. Just a different outlook on life. They're just different. They feel good.
Moving on then to the cosmetic part of your practice, the facial fillers.
Right, yeah. Well, facial fillers are very popular. Basically, as I think we talked about, patients get volume depletion. The collagen breaks down and they start to get hollow areas. They start to look in the mirror and see lines that they didn't have before.
What's the number one place where you're...
Nasolabial fold, right here.
Right there? Okay.
Number one place, absolutely. And in fact, if you look at this picture that we showed you here, you could see it's subtle, but she didn't like this little depression that she was getting right here.
By her nose, right there.
Absolutely.
Okay.
She didn't like that. And I want you to look at her jowls right here.
Okay.
If it's subtle, but she has that little notching, that little bit of jowling that's starting to occur. So the nice thing about fillers is we can go ahead and replace the volume up here, and we can actually augment here so it looks like they have no jowling. Now, it's
interesting.
Yeah, but it's important that you don't overfill. You don't want an unnatural look. That's probably the number one issue and mistake with fillers is patients get this overdone look. We don't want that. We want a natural look.
Okay.
And you can see that in the after, that's exactly what we have.
Very nice.
In the before, we have this little hollow up by her nose. In the after, that's all filled in now.
Yeah.
In the before, in the jowling area down here, there was a notch there. That's gone. And you think she might have had a facelift. That's the beauty of this.
Well, her chin and neck look totally different.
Absolutely.
So you just filled in this area to give it
a straight line, to get rid of that concavity. Yeah. Yeah. Fillers, are a nice way to make people look youthful today, and there's a variety of fillers on the market. What I like to do in one area that's very important is to frame the eyes. There's something I learned, Randy. It's if you can frame the eyes and you can frame the lips with fillers, you'll have an excellent result. And what do I mean by that? People get tear trowel deformities. They get these lines here. They get the lines here. What do you look at when you look at them? You're looking at the lines. You're seeing the aging. If you can correct those and put the emphasis on the eyes and the lips, now you've framed the eyes and you've framed the lips. Very, very important.
What about pain, though?
We can manage the pain. Number one, there's a couple ways. As an oral maxillofacial surgeon, we're really good at blocking the face. So that means giving local anesthetic. So we give the patients that option. And another option that has come about is mixing the material with the local anesthetic. So they might feel that first pinch, but after that, they're very comfortable. Very comfortable. So we can manage that, absolutely.
Now with technique, and you mentioned backing up a little while, how much is art and how much is science? Because we've seen maybe even some celebrities that are overdone.
Right.
They call it being done. We're in San Diego, Newport Beach is right over there.
Absolutely.
And you see people that are just
it's like, whoa.
kind of swollen, right?
Yeah, exactly.
Now, do you think that that's a request by the patient? Do you think that that's in the, the eye of the person doing it?
Absolutely.
What's your take on that?
Well, my take is you have to have the science because you have to know that the material works. But then beyond that is where the artistry comes in. Absolutely. And do they want to look like that? Well, even if they did, my daughter plays basketball. You have a deny defense. Even if they did, you got to deny the patient. You don't want them to look like that.
Okay.
Patients think they know what they want sometimes. It's better to go less than more and then show them the mirror. And they're going to like it if you do it right.
Okay, good.
Another popular area for fillers, Randy, is the marionette lines. Those are these lines right here. And also, patients come in, it looks like their lips are turned down. They have those little, yeah. And that's a sign of it. Women hate that.
What do you do for that?
Fillers. You can...
For the lips that are turned down?
Absolutely, because by filling that volume, and again, technique sensitive, you can actually go from a turned down line to a straight line, which is a line of youth. Okay. So yeah, very nice in those areas as well.
What about lips? You do a lot of lips?
we don't do as many lips as you would think. Patients seem more focused on these other areas, but when we get a girl that wants lips, the fillers are wonderful for that. And again, don't overfill because you want natural looking lips.
Because I feel like you could spot those big lips.
Oh, yeah.
Walking down the street.
I've seen them.
And it doesn't look good by
No, it doesn't.
Look, we're two men.
No,
I mean,
I've seen
too
them.
much, I mean, it's phony, especially profile view.
Absolutely. Profile view and even head on, you know the over lips, you know the overdone lips. And that's another thing, you know, dentistry, facial surgery, yeah, that's my background, and that all goes together because again, you're framing the teeth. You got to know what you're doing when you frame the teeth.
All right, good for you. Okay, so now we're moving into fractionated lasers.
Yes. Well, fractionated lasers, the home run is you get that wrinkly, crepey excess skin of the eyes. I mean, here's a great example right here. I mean, look at her eyes. I mean, they look, you know, she came in, she was complaining that she looked tired, and she has that excess skin below her eye, and what she had.
You call it crepey.
I call it
so
crepey.
So it's like a little tiny wrinkles, okay.
Yeah, it's just like that thin skin that just doesn't look good.
She looks like a young person though, otherwise.
She's a fairly young person, but she's aging. You know, she's seeing her mother's eyes when she's looking in the mirror. Now, one thing with this crepey skin, there's a couple ways you could have handled it. You know, you could excise it, which I think is really
meaning
not.
What?
Meaning you could pinch it and cut it off. You know, you could do an excision of that skin.
All right.
And before lasers, that's what had to be done. But now with lasers, you can rebuild the collagen, which in essence tightens the skin. And you get a very nice youthful result. Now she also complained about her eyes not being open. It kind of looked tired, and she didn't like that look. So we went ahead on her, as you'll see, and we did an eye lift for her and a forehead lift to open that up. But the main thing I'd like you to focus on in this patient is the laser resurfacing of the bottom lids. That is
so
huge.
In the after, I mean, very nice here.
Now this is a little subtle, Randy. If you look at the pre and post op, you know, it's subtle. We're not trying to hide anything. In fact, she has no makeup on.
On the after, right?
No makeup, but you know, you get a phenomenal result. You know, and it just gives her a youthful look that she didn't have before.
So with the laser, so help me understand this. Okay, so by heating that area, right?
Right.
It's filling it in with collagen, with tissue, with your own body stuff, or you're peeling away the wrinkles?
No, well, the main science, we talked about science, is you're really rebuilding the collagen. Then the skin is healing on top of that in a tighter manner.
Okay.
That's the science behind it.
So what does she say when it's done?
Well, this girl was absolutely speechless. She just loved the result. You know, when you leave with the laser resurfacing, you can see the result immediately also.
Okay.
Yeah, I mean, it looks smooth, but you see the real result about a week later, and you know, she just likes her bright eyes now.
Very nice.
Now, you know, Randy, if you look at those pictures, I mean, a lot of women have this excess skin, and what they try to do, they try to hide it with makeup. Okay. A lot of makeup actually makes them look older.
Good point.
Yeah, it makes them look older. So with a fractional laser, you can have them in. This is about a 30-minute procedure. You know,
and you can adjust the downtime. Is that correct?
Oh,
I mean,
absolutely.
You could go heavy or light.
Right, because a fractional laser can be a full CO2 laser. It has that capability, so you can definitely adjust it. It's a menu for that patient. You don't treat every patient the same.
Do you do it based on downtime? I mean, when patients go in, I guess some people have 3 days, or some people have a week or 2 weeks. What is that consult like?
Well, what we do is we base it on their need. You know, if they have that sun-damaged skin, you know, with all the wrinkles, it looks like a prune. Okay. I mean, I'm going to be honest with them. If you want a home run, you know, they're going to have about 10 days of downtime. We need full CO2. Okay. Somebody like this, the patient we just talked about, you can get away with 5 days of downtime and a fractional. So I tell the patient, this is your best result. This is what we're going to do for you. And if they want to step back from that, certainly we'll entertain that. But we make sure they're educated, that they know that, you know, this is the downtime that you want, and this is the result that we're going to give
you. Now, for people
that
just tuned in, I mean, you've written 2 in medical textbooks on laser. You've been using them for about 20 years.
Right. Yeah, at least. Yeah.
About 20 years. And so are you that much better now than you were back then when it comes to laser?
You know what?
As far as pushing maybe the machine, or what?
Well, I think technique-wise, we were on top of our game then, and we stay now. The technology has changed because now we have fractional. But obviously, as you do procedures and you see patients come in the door satisfied, like the patients we've talked, my team buys into that too. You know, the staff buys into it. They get excited. When they get excited, it's the domino effect. I mean, now they're talking to patients about it. So it is a process.
Good. Okay.
The longer you're in practice, you get patients out there talking, your team members that work with you, they see the results, now they're talking, and it's like a crescendo effect.
So you have all this technology. Do you think, I mean, when you're walking around, okay, Pittsburgh, wherever, do you see women and go, boy, they would be perfect?
All the time. You know, coming out here on the shuttle in the airport, you know, my wife's always laughing at me because I'm like, oh man, she could use this, she could use that. I mean, that's what we do. We notice people's faces.
And in a way, it's a quick fix. I mean, without surgery, without cutting,
absolutely.
like we said.
Absolutely.
Somebody could look years younger. On the consult, the women that come to you, do they want to look prettier? Do they want to look younger? Or do they want to look great for their age? What do they say?
I
what
think,
are their comments?
You know, it's all of that, but the main thing is, I don't want to look tired, I don't want to look mad, and I want to look refreshed. That's, you know, we don't have a lot of patients that come in and say, I want to look 20 years younger, because you got to be careful there. I mean, that may be an expectation that can't be met. But they want to look refreshed. They want to look more youthful. Not necessarily 20 years younger.
Is this one of those things? I mean, do the patients, of course, on the follow-ups, do they say, I'm getting compliments now? I mean,
well, you know, a lot of
they brag about what's going on in their lives?
Some do. Some are the announcers. You know, I had a lady that flew to Florida a week after she had her eyes and laser resurfacing done, and she could have cared less. And then some are the what I call the stealth patients. You know, they don't want anybody to know. But the comments they get, or have you been working out? Did you change your hair? You look more rested. What's going on with you? It's not like a beacon, I've had facial cosmetic surgery. It's not that at all.
So is this the new aging gracefully, in your opinion? Take advantage of the technology?
Absolutely. Yeah, and the technology is there, and Ultherapy is one of the things I mentioned.
Let's talk about Ultherapy.
Yeah.
Let's go right into that. Okay, so skin tightening. So for jowls, is it just for jowls?
No, actually Ulthera, jowls, and forehead. You can actually do a forehead lift with Ulthera. And that was the FDA indication when it first came out.
Really?
Absolutely.
Like what? I mean, who's a candidate for that? When you say forehead lift, are you talking about the brows that are
dropping?
dropping?
Yes, I'm talking about the brows.
Okay,
you can get 2 millimeters, which doesn't sound like a lot, but it is in the forehead area. So that's the nice non-surgical way to get lift, toning. See, with Ultherapy, it's intense focused ultrasound.
Okay.
We're treating collagen, and we're treating it deeper than you can with any other device. We're treating.
So it's heat, though, right?
It's heat, yeah, absolutely.
So you're heating, like, for example, the jowls. They're starting to drop. You heat them. What's happening?
You're heating the collagen.
What's causing the lift? That's the part I don't get.
Collagen. You're heating the collagen, and you're treating that within the SMAS layer, which is the same layer that we surgically treat when we do a facelift. That's the layer that gives all the support. So with Ulthera, you can treat the collagen in the SMAS layer. You rebuild it, you rejuvenate.
Does it like shrink wrap in a way? I'm trying to get this.
Well, collagen is the supporting structure of the skin.
Okay.
As we age, we lose it. You can put it back, you get the support, and you get the tightening and lifting. So it's not like shrinking, it's actually rebuilding.
So it's filling it in, and there's a bit of a lift. It's not a psychological lift. I mean, it's an actual lift.
No, it's an actual lift. Well, here, let me show you.
Okay.
There we go. I mean, there's a lady that came in that just didn't like the fullness of the submental area, the area underneath her chin. You know, and this is a gradual result. 90 days later, you see the result.
Is that one treatment?
One treatment. Right now, that's the technique, one treatment. Now, I think if we can get these ladies in their 30, 35, 40, when they start to have the jowling, you know, and we treat them every 3 to 5 years, I don't think they're going to age. I think they're, you know, you see the Hollywood.
We'll stop the process.
Yeah, we're going to stop the, you know, Randy, I noticed, if you don't mind me mentioning, you got a little bit going, just a little bit. You're a good-looking guy. You're a good-looking guy, but yeah, the little bit coming down here, you're perfect right now for Ultherapy.
So heat that area.
Absolutely.
And it'll tighten up a little bit.
Absolutely.
And then I'll be happy.
And then, well, you are happy, but you'll be happier. Let's put it that way.
Let me ask you a question. I mean, because, you know, I talk to a lot of the medical doctors in Los Angeles. They're on my show. We are all over the country in Canada. And the bioidentical hormone crowd, they say, Randy, Hollywood, you look at guys and women 5 years, 10 years apart, they look better now than today. They're all taking advantage of this. They're all doing it. And my buddies are plastic surgeons and laser guys.
Yeah.
and they say that that's why they look so good.
Yep, the technology is there. Just got to utilize it. Like we talked about Botox being mainstream. All therapy.
Does it hurt though, all therapy?
Well, there
is
again.
Is it all therapy? How do you pronounce it?
It's all UL therapy.
Okay.
Okay. With all therapy, we can manage the discomfort. There is some discomfort, very manageable though. Most patients don't even take a Valium. Some I can block, like I said, as far as local anesthesia, we can make them very comfortable. I've had a few patients, very few, that wanted IV sedation, but most of it is no Valium, just they come in, and it's actually very enjoyable to do. And what I've noticed is patients, especially when we're not doing their jaws, when we're doing the upper forehead, they love to just talk. You know, it's like a nice session there. It's amazing. Yeah.
Okay.
They're very relaxed.
So with you know, somebody watching this, okay, so you said that it'd be nice to get the people earlier. So 35, 40, get them in, hit this area, keep it nice and tight.
Right. Right.
Forehead to keep the brows up.
Absolutely.
And then if you fill in the lines,
home run.
Life is good after that.
Life is good. Life is good. And that's the message.
I mean, how early should they come in?
When they start, probably right about the way you look. You know, when they start to have that little bit of jowling is a time to come in for all therapy. Botox, when they start to get, I mean, I see 25-year-olds that could use Botox because they have the heavy brow. You know, they have those lines starting to form. Some people have a heavier brow than others. So it's individual, but I've had ladies 15 years in the practice, 20 years in the practice getting Botox. Unbelievable. I mean, they don't have any more wrinkles now than they did 15 years ago. So it's a maintenance thing. You know, got to do your homework. You got to get the maintenance, but it works.
So we're out of time. Final message though. Somebody watching this, they don't like the way they're aging. What do you say to them?
Come see us. I mean, we have the technology and the tools, experience, and the training to give them that youthful look. Just come see us.
All right, great. I want to thank you for coming on the show. Great
Thanks,
stuff.
Randy.
Great stuff.
Great being here.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again, you can go on our website at wellnesshour.com. Just put in Dr. Halusic's name. For now, I wish you good health.